The tide of coronavirus has steadily retreated in China. Macau has reopened its border with the mainland. Visitors arriving from the world's biggest gaming hub will no longer have to undergo a 14-day quarantine, but they will need an approved customs clearance certificate and a negative test within the previous 7 days. Macau's government is allowing 5,000 travelers a day to cross, a number which they say will gradually increase. Beijing has tested 12 million people for COVID-19 in the past month. That is half of the city's population. This came after the first case of a cluster outbreak appeared on June 11th. And Thursday marks 100 days since the last restrictions were lifted in Wuhan. The one-time epicenter in China was put under an 11-week lockdown soon after COVID-19 broke out. But both outbound and inbound travel was prohibited. Residents were also banned from any non-essential activities. And those actions proved to be effective in curbing the coronavirus from spreading to the rest of the country. Joining me now from Shanghai is Dr. Richard Cheng. He's an American doctor who has treated coronavirus patients in China. So, doctor, it's been 100 days since that lockdown was lifted in Wuhan, a big number. What has been working, do you think, since their reopening? Any big lessons that others can learn from?
Yes, ma'am. Thank you for having me on the show again. I believe the measures taken by the various governments in China have been effective, for short term at least, by social distancing, lockdown, wearing facial masks, and general precautions like that. And so even with the recent outbreak in Beijing, and I understand that the farm, it's called New Farm Hub, is reopened again. So these measures are necessary for short term, and I think that those are the measures that we should learn worldwide by various governments. And later on, may I read a statement to you?
Sure.
And I hope that, at the International Society for Orthomolecular Medicine, which is known for vitamin C, we believe regarding the management of COVID-19, we of the International Society for Orthomolecular Medicine, ISOM, and the Orthomolecular Medicine News Service Editorial Board, OMNS, believe that the medical advice given to the governments worldwide, especially the federal government of the United States, is seriously incomplete. The current COVID-19 management plan virtually ignores the importance of our own immune system against the SARS-CoV-2 virus. Not only is such omission contrary to common sense, it also dismisses decades of abundant basic and clinical nutritional research and experience. We need to protect all of our citizens with nutritional prevention and include nutrition-based therapy in all hospitals. We urgently appeal to governments worldwide, especially the President Trump's administration, to open a dialogue with experts at the International Society for Orthomolecular Medicine and like our like-minded experts worldwide. Our common goal is to improve the current COVID-19 management plan and to implement nutrition therapy to prevent and treat COVID-19. We can change the course of this pandemic. In the absence of medication or vaccination, our immune systems are our best defense. We can and must promptly employ and publicize protected population immunity measures.
So, Doctor,
for details, please contact us.
Doctor, let me interrupt you there quickly. So basically what you're saying is, you know, a lot of countries aren't even on the same page when it comes to prevention. So I have to say that because you have countries in Asia who are used to wearing masks, and in the West, not so much. But I want to ask you about the biggest difference you're seeing when it comes to how people are viewing the prevention of coronavirus, not medical experts or doctors, but how regular people are viewing coronavirus in China versus other parts of the world.
Yes, a couple of points I'd like to make point out is that one is that from all the data we see, COVID-19 is a serious disease. However, the severity measured by the case fatality rate, COVID-19 is not much more serious than a bad influenza. And I believe people are panicking and fueled by various sources. And the people worldwide probably don't take it as seriously as we should. And the people here in China see, under these circumstances, usually are more, for lack of a better word, more obedient or more following the orders by the governments. And that's a lesson that we should all learn. This is not time of debate. We need to follow some common sense measures like social distancing, wearing masks, and a lockdown for a short period of time.
All right, Dr. Richard Cheng, thank you so much for joining us from Shanghai.